2, 3, 4. Keep pulling. 5, 6, 7.
Stairs in whichever manner you feel comfortable.
Because I guess this is this is the way I get down in the pool.
Okay, that's fine. Then how do you get out of the pool?
I get to the second step sitting up there.
Uh-huh.
Then Jerry has to help me out, or my daughter.
Okay, so I will help you if you need help, but right now you have the railing, and I want to see you try to get up the stairs. You can use 2 hands on the rail, that's fine. Well, yeah, you might have to do it both on the left side.
Oh, okay.
Is that where you have pain? Where is it? Where's it hurt, honey?
Right here. It's okay now.
Right down here?
It's going right there, right where
That's,
you are.
okay.
All the way across.
All the way across right there.
Yes.
Okay, get up with the other one then. Get up with the other leg instead. Oh, you're still using the right one to get up. You could put your left one up instead. There you go. Does that one hurt too? Does that one hurt too?
Yes.
What's that pain level?
Oh, 5.
5?
Yeah.
You can do it.
Oh,
Oh, we found it. We found the spot. That's what we need for Dr. Davis, honey.
what spot?
Where it
Pull.
hurts.
1, 2, 3, 4. Keep pulling. 5, 6, 7. Deep breath and pull. 1, 2, 3, 4, 5, 6, 7. Deep breath and pull. 1, 2, 3, 4, 5, 6. Keep pulling. 7. Deep breath and pull. 1, 2, 3, 4. Keep going. 5, 6, 7. Deep breath and pull. 1, 2, 3, 4, 5, 6. Excellent. Deep breath and pull. 1, 2. You got it. You got to do it.
Oh,
You're tough. Go. 3, 4, 5. Pull. 6. Yes. 7. Good. Deep breath and pull. 1, 2, 3. Pull. You're doing it. 4, 5, 6, 7. Good.
cruise.
Look at you.
You're one tough cookie, Marlene, let me tell you.
Deep breath. Pull. 3. There you go. 4, 5. Good. Down again. Deep breath. Pull. 2, 3, 4, 5, 6, 7. Deep breath. Pull. 1, 2, 3, 4, 5, 7.
Is my leg going to be skinny when I'm done?
It looks real skinny in here, let me tell you. How you feeling?
Good.
Good?
It doesn't feel as stiff, I swear to God.
So you feel looser?
Yeah.
Uh-oh, look out. Marlene's on the loose. All right.
It sounds like we're popping popcorn. Okay, so Marlene, you just finished your treatment with Dr. Davis. Let's get a gauge how you're feeling right now. Please stand up. All right. And did that cause any discomfort?
Nope.
All right. So next thing I want you to do is take one
And
step.
the stiffness is not there.
The stiffness is gone?
Gone.
Good. So we're going to have you take one step forward. And I want you to try to do a squat. Hands in front of you. Squat as low as you can and then come back up. Get down. Woo, girl. Did you feel any discomfort doing the squat?
No, just scared.
You made it though. Is Jerry laughing at you?
No, Jerry's, I don't think you want it on there.
Okay, so let's try these stairs. Come on down, Marlene. You're the next contestant. All right. You're doing this a lot faster.
Yes.
How'd that feel?
Good. It's not.
Tight and stiff like you said. Awesome. I'm going to have you turn around. I'm aiming for the feet. Go ahead and turn around and go up the stairs. You're doing that a lot faster too.
Yep.
What's your pain level there?
None.
None?
None.
All right. So you did the stairs. Okay, that's why I didn't understand it. I was like, wait a second, but because I saw you holding on and making your way. Are you just afraid you're gonna fall?
No, I need the help right now, and I've fallen 6 times.
So you are afraid of the balance, and that's why you were holding
Right.
on for balance.
Yes.
So-
I need it.
You need it
I
for
need
strength.
it. Yes.
I'm trying to understand because you said you had no pain when you're going up, but you were holding on really tight.
To help pull me up.
Okay, so it's the strength. I got you. But you have no pain, so now we're going to work on your strength. So you have no pain?
No,
That's amazing.
it's not that.
You don't feel
No.
that tightness. It's not all constricted around there.
No.
Awesome. Well, that's without all the therapies. That's just the treatment. All right, let's keep going.
Here.